to let you know that the chat feature is actually off, but the Q&A feature is on. So we did send out a Google form to capture some questions in advance, and we thank you for submitting some of those questions. And then you will be able to add questions to the Q&A. And Ms. Gurka will be monitoring the Q&A, and we will definitely have some time at the end of our presentations to cover those questions. So why don't we go ahead and start? There's a couple of housekeeping pieces I wanted to go over first. And the number one thing is I'm going to ask Ms. DiMattei to address our Spanish-speaking audience about how what we're going to do regarding the translation. Ms. DiMattei.
Buenas noches, padres. Si necesitan traducción en español hoy, lo sentimos mucho, pero no estamos preparados para dar traducción. Lo que sí voy a hacer es, vamos a grabar esta junta, la voy a grabar en español yo, y mañana la mandamos a familias que necesitan esto. Así que mil disculpas, pero hoy no habrá traducción en español. Mandaremos esta junta en español mañana. Gracias. Por correo electrónico. Gracias.
Okay, thank you, Ms. DiMattei. I see we have more participants. Let me just reiterate again that the Q&A feature is on. So if you want to ask a question, you can simply click on the Q&A. That should be at the bottom of your screen and add your question. We had some questions already submitted from the Google form we sent out. We appreciate that, but you can add your questions to the Q&A here as well. The chat feature is not on, so we're just going with the Q&A. And I think we're going to begin. And let me just say hello to everyone and thank you for joining us tonight. This is a meeting that I think a number of schools have had, and I think it's time for Bayside to have a conversation with our community about COVID and our numbers, to give you some information, to answer some questions. I just want to kind of give you a little context for this. Many of you probably know I have children of my own that are in our school district. And so I can tell you that I've been dealing with this obviously from being the principal here at Bayside, but also as a parent. And so I know the frustration, the anxiety, the stress that all of this causes as a principal and as a parent. And so, as we're talking tonight, obviously our focus is on Bayside. But this is something that really has, has all of us focused and trying to do the best thing for our students and for our families, not just here at Bayside, but across our school district. So just wanted to give you a little bit about that background, that I get to do this at home, at school, and then I get to go home and deal with the stress and anxiety around COVID as well. So just wanted to give you that little context, and I think we're gonna jump in to the slides. So the way this will work is we do have a slide presentation that hopefully will provide you some information, and then we will take time at the end to go through questions. This really is, we're not gonna be able to answer everyone's questions. That's what I'm guessing. And so what we will do is, if we're unable to answer questions, either because we don't know the answer, or it's something that, we might have part of an answer but need to get into a little more detail, we will capture those questions. We will respond to those questions in writing and send it out electronically. So we really do want this to be an opportunity for people to feel that, that their questions have been answered, and we'll work hard at doing that over the next few days. Again, thank you all for being here. Really, really appreciate it. We are a community and we want to work on this together. And so with that, Ms. Gurka is going to present the slides. And this is our COVID webinar. And we're going to jump right into some data. So we're just going to put it out there as far as the numbers. And one of the things, I know there's some questions and comments about all the letters that go out with each case, and we'll get to that later on. But if you're following your communications closely, you'll notice that you're getting a lot of the general school letters. So these are the information. They're very general letters that go out to the entire school community when we have a COVID case. And so far, we've had 15, as of today, 15 cases. We have 824 students, and we've completed about 4 weeks of school. So we have about a 1.8% positivity rate, and you can see the breakdown on the screen of students from each grade level. What's interesting about this is it hasn't happened it didn't happen in a 4 or 5 day span. Our first case was on August 13th. We had another on August 17th. We then had basically a 10-day pause where we had no cases. And then on Friday, August 27th, we've had no cases the 27th, the 28th of August, the 30th of August, September 1st, September 2nd, September 3rd, September 7th, and September 8th. So it's been spread over time. And again, you see the numbers here for each grade level. We're going to talk about tracking all of this in just a moment, but these are the numbers for Bayside. We do know that there's been a couple of hot spots in our school district. One of our elementaries did have a couple of classrooms have to shut down, and some other schools that have been hot spots, but certainly Bayside is definitely a hot spot in our district. Okay, so we're going to jump right into this contact tracing piece. So I'm going to start with elementary school. And we are following the definition from the California Department of Public Health, which is less than 6 feet apart for more than 15 minutes in a 24-hour period. As you know, elementary classrooms are self-contained classrooms, so students are in classrooms all day. They're moving around. Students are moving around and interacting with each other. Give me 1 second here. Okay, and so they're in there all day. So our school district for elementary decided to cast a wider net than the CDPH guidelines, less than 6 feet apart for more than 15 minutes. And they considered the entire classroom a close contact. Okay, so this is important to understand. The elementary definition of the close contact right now is anyone in the classroom. Okay, so it's a wider net than the Department of Public Health. So when a positive case is reported on the elementary side, the entire class is considered a close contact and placed into what is being called modified quarantine. So contact tracing on the middle school has evolved, and there's been some shifting around of this. When we started the school year for that first case that we had on August 13th, we were following the CDPH guidelines, which was less than 6 feet apart for more than 15 minutes. And so when we had our first situation, we did the contact tracing. We have our seating charts for every classroom. We went in, we identified the students that were less than 6 feet apart for those 15 minutes. Remember, middle school, their classes tend to be about 45 minutes each period. And so we did that from the students' first period all the way through 7th period, their whole day. We did that, use that practice for contact tracing. Then on August 18th, as our school district started to see there were some cases at a couple of different of our middle schools, they decided, starting on August 18th, to cast a wider net. And so this is pretty significant, because the wider net meant that for middle school, one student has probably, is in class. Remember, it's 7 periods and there's, 25 to 30 students in each class. So we were, just the sheer numbers, it was roughly 120, 130 close contacts that were put into modified quarantine for each case of, every time we had a middle school case. So it was a much wider net that was thrown out. Now, here's the thing to think about. So you may have a child who is fully vaccinated, was in the classroom of a student who was COVID positive, but maybe sat, 25 feet away from that student and really had no risk at all of catching COVID from that particular student, but they were still put into this wider net. And they were still put into modified quarantine. And that's why we were sending so many of the modified quarantine letters out to so many of our families. And that was, obviously that brings up a lot of anxiety and nervousness. And it's really disruptive to so many families whose kids now, have to go get tested, can't do after school activities. It's very disruptive. And so that was a concern for us. It was also very difficult to manage from a school end, just the logistical challenge of tracking everyone's testing and making sure everyone was doing what they needed to do per the letter that families received. And so it was very challenging. On September 3rd, our district decided to shift back to the true definition of contact tracing for the middle school. And here's why, and this is important to understand. So when we were doing the wider net, one student, as I said, say it's 120 or 130 students, after the first, second, third time of doing this, we saw there were no positive results. All the testing results were all negative from the students that we were mandating go out and get a test. And so there was no evidence that the spread was happening in the classroom, because the kids we were saying that were now on modified quarantine that needed to get a test, their results were not coming back positive. So we were not seeing the spread on the middle school side in classrooms. And so the data we were looking at indicated that it was not necessary to throw that wider net out, that we could go back to the CDPH guidelines. And that is what we are currently doing on the middle school side. Okay, so classroom spread, there's been a lot of talk about that. And I just got through saying we haven't seen classroom spread on the middle school side. However, we have seen classroom spread on our elementary side. We had 4 cases come up in one classroom. And our school district is basically saying classroom spread occurs when you have 3 or more cases in the same classroom that results in a classroom quarantine. So we have had one classroom, second grade classroom, that had to go into quarantine for 14 days because there were 4 cases from that one classroom. As I just explained, the middle school cases, there's not much evidence of spread through the classroom based on the data we've been collecting. And so that's why we've reverted back to the original definition from the Department of Public Health. So I think one of the questions is what's happening? Why do we see the number of cases that we're seeing here at Bayside? And as we mentioned, other than our second grade classroom, we haven't seen the classroom spread on the middle school side. But what we are seeing is that many students, and when I say many, it's been conversations with parents who have said, yeah, we've sent our kids to school, even though they weren't feeling that great, or we've been sending kids home who have come to school not feeling well. A lot of kids that are not asymptomatic, they're symptomatic coming to school. And that's been something we've noticed a lot of. So one of the things we're saying is that, please keep students home who are not feeling well. I know how difficult that can be. We all have to get on with our lives. We all understand that. And so if your child wakes up sneezing or with the sniffles, or maybe a little bit of a headache, and in regular times we would say, you know what, tough it out, go to school. We don't want you to miss. You only have the sniffles, you're fine. It's a little bit of a different world now. And obviously I told you I'm a parent. I understand the challenge in that. Our kids have to live their lives. But right now, we're seeing too many kids coming to school who aren't feeling well, who are symptomatic, and we're just asking for your support and doing what you can. Please keep your kids home if they are not feeling well. That's really important. Let me go back to the close contact and modified quarantine definition for kindergarten through 5th grade. It's a close contact. We said all students in a positive cases class. The modified quarantine, so this is what we mean. This is what happens when a student is put on modified quarantine in the world of elementary, it's 10 days from the date of exposure. And then the close contacts, those students on modified quarantine, need to take 2 tests. At least one of those needs to be a PCR test. And they must, before they can come back to school, they must have a negative result of, we must receive a negative result of the first test. Now that test can be a rapid test, but they must show a negative result before returning to school. This is something that's really important to many of our leadership folks at the district level, to people at the state level, this idea of so many students missing so many days of school. And so while we're trying to be really tight and stringent with, the guidelines and with turning in negative results before returning to school, we also understand we can't have students missing days and days and days of, huge numbers of students missing days and days and days of school. And so we are, we want to try the compromise there is that, yes, you turn in the rapid test. It can be a rapid test. If it's negative, your child can return to school. They must be asymptomatic, of course. We already talked about that. And then if you're on modified quarantine, we ask that the child not participate in any extracurricular activities until the modified quarantine period has ended. So again, it's quite disruptive. And I know, and I wanted to say this earlier, I do receive a lot of emails, and there are some people feel very strongly that everything we're doing is way too disruptive. We need to get on with our lives. And this idea of so many students be putting into modified quarantine, that's not good. The numbers don't show that. You should be doing it a different way. And on the other hand, we have families saying, we need to be as stringent as possible. And so there's really, it really depends where you're coming from and your point of view. We do understand both sides of that. And that's why we did make the switch with middle school, because we're not seeing the evidence that necessitates us to have such a wide net on that group of modified quarantine students. Ms. Gurke, you can go to the next slide. Okay. So for modified quarantine for middle school, the close contact, again, it's 6 feet for at least 15 minutes. There is a difference. It's differentiated between unvaccinated and vaccinated. The unvaccinated students are placed into modified quarantine, again, for 10 days. They need to take 2 tests, same thing, with at least one needing to be a PCR test. And they must have a negative result of the first test, again, that can be a rapid test, before returning to school during modified quarantine. They need to be asymptomatic. And if they're unvaccinated, they cannot participate in after-school sports or extracurricular activities through the duration of modified quarantine. Vaccinated students are different. Vaccinated students not placed into modified quarantine because they are vaccinated. And again, following CDPH guidelines, they are not required to be in modified quarantine. They can be in school if they're asymptomatic. We still ask that they take a PCR test 3 to 5 days after the exposure and that they submit results to the school. They may participate in extracurricular activities as long as they're asymptomatic. So again, it's differentiated between unvaccinated and vaccinated on the middle school side for modified quarantine. Okay, one of the things, and this is all over the place, encouraging your child to get vaccinated. We're seeing that students who are eligible for the vaccine and are fully vaccinated are not as at risk as students who are not vaccinated, indicating that, the students who are coming down with COVID, the huge majority are not vaccinated. And obviously we know there's the whole, the students who are younger than 12 cannot be vaccinated at this time. And that's a huge number of students at this school. But if your child is 12 or older, we do recommend the vaccination. And it says vaccinated students, reiterating the slide we just went over, will not have to be under modified quarantine if they're a close contact. Okay, so questions about what we're doing as a school and as a school district for our mitigation strategies regarding COVID. Um, and for the elementary, one of the big switches we made was going to whole class PE. The other thing, and I know this is painful from some of our families who like to gather at the beginning of the school day out on the playground in the back there with our elementary students, but we're asking families to drop off at the front gate. Also, the mandatory mask wearing inside. And we are strongly encouraging students to wear their masks outside. And most of our students are being very cooperative in that area. Hand washing, hand sanitizing when entering and leaving a classroom. Grade level assigned bathrooms. There is no spacing requirement per the CDPH at this point in time. There was last year, there's not currently, but we are asking that desk spacing as much as possible, as much as the classroom space allows. So that's the conversation we have with our teachers about that. Every classroom has 2 air purifiers, and there are 3 in our kindergarten rooms. We want doors open as much as possible, windows open. Again, children staying home when a sibling or a household member is not feeling well and or someone in the household tests positive for COVID-19. And then we're strongly recommending testing for all family members once per week. There's been a lot of advertisement out there about all the testing locations. So yeah, that's to do that once a week. We realize that's a big lift, but the testing is key so that we can, make sure that students, a lot of asymptomatic people that are COVID positive. So that's, the best way to know and to keep people at home when they should not be coming to school. Okay, for the middle school, I want to talk a little bit about this. It's actually on another slide, but mandatory mask wearing inside and strongly encouraged outside. We realize middle school students can be a little bit more playful, let's say, and more challenging as far as behavior. That's the nature of middle school students. And so we have been sending around our Dean of Students, Lori Rossi, to monitor, to go into classrooms and just make sure teachers are enforcing mask wearing in the classroom. I did receive some emails about, concerns that, there's a couple of classrooms where it's not being enforced as much. So we are, I've been in classrooms a lot. And as I said, our Dean of Students is walking through classrooms. We have conversations with our teachers all the time to say, if you have a student who is not abiding by the mask wearing, don't hesitate. You ask them once, and if they don't cooperate, you call the office and we will deal with the student. It's a serious, if a student is not wearing his or her mask, that's a serious problem and it needs to be addressed right away. So I appreciate parents letting me know about that. And I would encourage you, if you are still getting reports from your child that kids in a class are not wearing their masks on a regular basis or anything like that, or even messing with their mask and just not taking it seriously, you can certainly let me know. I would really appreciate that. We're not in, our office team can't be in every classroom every day, obviously, but we're doing our best to monitor that. And the truth is, overall, the reports I'm hearing from teachers and from office staff and supervision staff is that kids, even out on the playground, a lot of kids are doing a really good job wearing those masks. It's not mandated outside, so we just ask students and encourage students to wear their masks outside, but they're doing a good job with the mask. So I wanted to talk about the mask piece a little bit. Hand washing, hand sanitizing, of course, throughout the day. Separate lunchtime eating spaces. We went to this model. Basically, it was the second day of school. Remember, we started on a Thursday. We had school Thursday, Friday, and that weekend our team sat together and came up with a different way of doing lunch. We observed what was happening at lunch. It was just not, it just ended up, we thought it was going to be enough space and it wasn't. So we had to sort of rearrange how we did lunch. And so now we're separating out the eating spaces for each grade level and the play time. So 7th and 8th grade play on the blacktop together. And then when they come in to eat, the 6th graders go out and play. So that's a new thing we're doing this year. on our campus. Desk spacing, same thing, as I mentioned in the elementary classrooms. 2 air purifiers per classroom, doors open, and again, staying home when someone in the household is not well, excuse me, and strongly recommending testing for all family members. Okay, a lot of conversation about pool testing. There was a lot of communication being sent from our district, from Superintendent Ochoa about this. And we are going to begin pool testing as of right now. The date we've been given is Monday, September 20th. And the way this works is basically there's a company that comes in, biotech company that comes in and goes into classrooms, and they do they have everyone swab. The students do it themselves. Then they collect that swab into basically a container that they will go out and they will have analyzed. And if there's any COVID in that jar, they come back the next day and they will do individual testing. So when they come the first time, it's anonymous. Every student's doing their swab. They put the swab into a jar. The teachers are included in that as well. And then if there's COVID, they come back and they do individual testing to see actually who has COVID. We have been told they come back the next day. The slide here says they come back later in the week. Our understanding is that the company would come back the very next day. Now, if you don't want your child to participate, you don't have to have your child participate. You can sign a waiver. You must sign a waiver to have your child to participate. And again, if you don't want your child, that's okay. All staff will participate in pool testing as well. So here's the thing. It's the second point, the second bullet up here, and I didn't mention it. The pool testing is going to start in all elementary classrooms and in 6th grade. They still are working on trying to figure out how to do this effectively in 7th and 8th grade. And so a lot of it is that, you know, the kids in middle school, they move from period to period. And so we're going to have to figure out some system to make this happen. And this isn't just a Bayside thing. This is across our district. We're going to have to work on a way to get 7th and 8th graders tested. And so that's something I'm personally not involved in, with trying to come up with that, with the logistics for that. But I do know that they are working on it now so that 7th and 8th graders would be included. But for starters, they're going to go K-5 and 6th grade. Couple other topics, short-term independent study versus long-term. So there's been a lot of questions about, are there any alternatives for our children this year? One thing I can tell you is that the state of California is not allowing public schools to deliver instruction through distance learning. And what that means is basically the system we had last year that we were using in San Mateo, Foster City, it's not allowable by the state of California. What you can do is you can shut down a classroom, you could shut down a grade level, you can even shut down a school and do remote learning for 10 days or 14 days, but you cannot put your whole system into distance learning. That's not allowable. That's not county, that's not district, it's state of California. That being said, the state is also saying that we must allow for what they're calling long-term independent study. So long-term independent study is when, as a family, you make a decision for your child that you want your child to not be in school to do independent study. But please understand, independent study is not distance learning. It's independent work with a very, very little face time with an actual teacher. And I believe it's literally just a few minutes every week, and it's not a significant amount of time. It's truly independent study. We've had, I don't know what the count is exactly. I believe we're at about 80 families throughout the school district that have signed up and have been approved for independent study. I do know that the last I checked that they are still taking applications for that through the school district, but that is long-term, and you become part of that. Basically, it's like a virtual school. You're no longer, if you sign up from out of Bayside, your student would no longer be a student at Bayside. They would now be attending the independent study program. And so it's a pretty significant, it's a big move. It's a pretty big move to make, because it's not where your child's with a teacher on the screen for most of the day. It's not run that way. The short-term independent study is something that's evolving right now. This is for students who are out between 3 and 14 days for COVID-related reasons, where basically teachers will have up on their Google Classrooms the assignments that students are missing. And then there would be a check-in with a teacher, whether that be elementary or middle school, each day to see how the child is doing. So just a quick 15 to 20-minute check-in with the student. And so that's something that is, our district is working on that piece right now. Many teachers, if your child has been out, many teachers will have been working with families already, and students have been doing their work. But this is going to become more of a formal process through our school district to meet the needs of students who are out for extended days for COVID-related reasons. Testing sites, a lot of information has been generated and put out to our families regarding testing sites all throughout the district. Bayside, we are a testing site. It's every other Saturday. Actually, that's not true. It's the first and third Saturday of each month. It's a group that comes out from the county. It's basically a mobile van that parks in our parking lot, and they were set up here last weekend. I actually came out on Saturday and saw a few Bayside families out here. And so that's here. Won't be here this Saturday, but it will be here a week from Saturday. And so that's something we've been doing actually since last winter. Last winter, they've been coming out here. But now there's places all over our district, many campuses hosting testing sites. So the more you get tested, we think that at this point in time, the better. I already talked about proper mask wearing. It's something that we continuously reinforce with our students. They're doing a good job overall, but obviously we have to monitor that. We will continue to do so. Okay. All right. So at this point in time, and I do invite people to add questions into the Q&A if you have questions. And let's see here. I'm going to start off with the questions that were sent in to us ahead of time. There's not many, but the first one is, when will school implement pool testing? And I know I just said it. What was the date? Anyone? September 20th. Okay, so it will start on September 20th. So is it possible to let us choose distance learning classes for students? So as I said, it's not called distance learning. Independent study is not distance learning, at least the way it looked like last year. So there is no distance learning. If you're in your mind, your definition of distance learning is what we had last year, that does not exist. But if you want to look into long-term independent study, you can certainly do that. There's lots of information on our district website about that. And if you have more questions, you can certainly reach out and ask us about that. Does school have the plan for hybrid classes for students? We do not. We do not. And that is, again, it's not San Mateo, Foster City, certainly not Bayside or even the county. It's the feedback that came in across the state of California, how damaging it was not to have students in school. And again, this gets back to your own personal beliefs about this, right? And so I'm not here to convince anyone either way. I'm just saying that the voices were heard that it was very harmful not to have students in school. And so this idea of doing distance learning or doing hybrid, we're going to shut down a class. We might shut down, as I said, a whole grade level at a secondary, at a middle or high school. We can certainly close a school for 10 days if we needed to. but we're not going back to hybrid or distance learning permanently. So again, that's from the state of California. And I'm sure there's some strong opinions about that. If we choose independent study at home, how can we have the exams for third graders? If we're talking about, yeah, so here's what I would say is I'm not familiar enough with independent study as far as how they're having students take tests or anything like that. I don't really know the answer to that question as far as test taking. If this question is more about standardized tests with the state of California that all students do, and usually in the springtime, I'm assuming the independent study students would have to take those tests. I'm not sure if that's what the question means, but again, I'm not very familiar with the independent study model, only to say that it is mostly independent work. Okay, what happens? Okay, so this question is about the fact that students who test positive for COVID, and this is according to the county, they will, COVID will stay in the person's systems for up to 3 months. And so basically, I'm not the medical person, so when I say that, I mean traces of COVID. The person isn't contagious, but traces of COVID will stay in the system for 3 months. And so there's a great concern from some parents whose children have tested positive for COVID. When we do this pull testing, how's that going to work? Because my child's going to disrupt the entire sample. It's going to show there's COVID, and it's because my child already had COVID a month ago, and now it's going to show as a positive result for the class. So that question has come up at our district level. I don't know how they're going to address that. I don't know if they're going to ask families whose children already, have been COVID positive to refrain from participating. It's a great question, and I just don't have the answer right now. And the question I have in front of me says, are they going to ask for a letter from the county for those who have already given them? So yeah, I don't know how our district's going to handle it, but I will say it has been brought to the attention of the people managing the pool testing that this is going to be a problem, that if students who take a COVID test, before 3 months of having COVID, they're gonna dirty the sample, basically, right? And so I don't know what the answer to that is, and it's something we're gonna need to get an answer to before we start. So very good question, and we'll look into this more and see if we can get a more definitive answer to that. We'll do that. All right. This is a couple of questions related to the same thing here. Hillsdale High School's COVID-19 exposure notices list the exact dates of the exposures. They also notify all the people in the classrooms of the infected person so that they can take appropriate steps. Can Bayside do this too? I know this is extra work, but I think our school community deserves to know this. So there's been a lot of questions about that. And this is the general question, the general letter. It's a very basic letter informing families there was a COVID test at Bayside. What I will do, because I know my name's on it, I recognize that it's not my letter, it's a letter that comes from our district. And so I will revisit the general letter with our district team, and I will try to find out if there's anything we can do. And people do recognize there's confidentiality issues with those kinds of letters. And so I think some of it depends on how you interpret the confidentiality rules. And yeah, I don't, I'm following the direction I'm getting from our school district with those letters specifically. And let me read the other question that's related. I work for San Mateo County Public Health Department's communicable disease program, and I know that the county advises businesses to inform and expose people of exact dates, times, and locations of exposures. In this manner, they warn people who need to be warned, but the people who are not at risk do not need to worry unnecessarily. So it's very important, right? Bayside's general exposure notices are so general that they are not helpful at all. Okay, and so again, back to that, the general exposure notice. Let me go back, and I certainly can't sit here and make promises that I'm going to be able to change this, but we can bring this concern to our district leadership and see if there's any tweaking that can be done. Yeah, we realize that these letters are coming out to you. Lately, it feels like it's been daily, and we're feeling it here as well. And so you might be talking to parents from other schools and they seem a little bit more nonchalant. There's some schools that have had very few cases. And as I said, other schools have had a lot of cases. We're one of the schools that have had a lot of cases. So we are feeling all of this, and we understand the anxiety it causes every time a letter goes out. So I will look into that for sure. Okay, that wraps up the pre-submitted questions. It looks like we do have some questions in the Q&A. Those of you that came in late that might still be interested in posting a question, you can do that in the Q&A at the bottom there of the screen. And
let me just jump in, Mr. Cosmos. I was trying to do slides and answer questions at the same time. So my apologies. We haven't gotten to all of them, but I have tried to answer as many as we could. So I just see a few left. Please, if you did ask a question that was answered, feel free to take a look at the Q&A where the responses are there. But the few that I haven't quite gotten to yet, one is, couldn't they do pool testing during PE since it's outside and similar to how they would take like school pictures, for example? And I think I know the answer to that, but I don't know.
I'm going to let you do it.
Okay.
Go ahead, Ms. Gerga.
So I actually had that similar question. It seemed like that would be a much easier way to do it, picking a subject or something as opposed to just a time of day. But what I understand is that the company that's coming in to do this pool testing is only here for a certain portion of the day. They're not here from 8 till 3 because their courier has to pick up the test to get them back to the lab to do all of whatever medically they do with those. So it couldn't happen throughout the day. It would have to happen at a certain time. And right now, as I think we mentioned, it is set for first period. So hopefully that answers that question. One for you, Mr. Cosmos. Has Bayside considered doing rapid tests for the kids so that they don't miss the whole day of school?
Great question. Yes. One, I want to say it was on a month. So we learned of some positive cases over the weekend, and I'm losing track of the weekends. I think it was the weekend of August 28th, I think it was Saturday, August 28th. Anyway, we came back to school knowing that we were going to have, students coming to school that couldn't be here because they didn't have a test. So our school district did provide 30 rapid tests, and we actually brought those in, and our nurses came and they administered the tests to, we were done, that we used every last one of them. By the end of the day, we didn't have any left. And so that is something I have requested, because back to the point of not wanting students to miss school, if they can come into the office, take this rapid test, we can see that, if the result is negative and if the child is asymptomatic, they get to go to class. So yes, the answer to that question is we've done that before, and we're going to continue to request that we are provided with those rapid antigen tests. And so that's going to be something we're going to continue to do.
Okay, next one. And I know it is 6:15 right on the dot, but we have a few more, and I think we have a few more minutes. So is it okay if I just?
Yeah. So yeah, thank you, Ms. Gerga. We did say 6:15. I think we put it out there, but there's a board meeting tonight, and we certainly don't want to interrupt the board meeting. It starts at 6:30. So we'll go 10 more minutes. We'll go to 6:25 if we need that much time. If anyone's like hopping off, they've heard enough, or, I just wanted to thank you all for hanging in there with us, and for these past 45 minutes. Means a lot to, I see 57 participants. So thank you for being here. All right, you can keep going.
Sure. So next question. And again, I think I know the answer to this, so I'll take a stab at it. But would middle school close contact guidelines be revisited if the 6-foot space still results in other positive cases? So maybe to like a 10-foot distance. And I think the answer is absolutely yes. If anything you've learned about us through this is we are incredibly flexible. We are changing, sometimes feels like not even daily, like hourly, we're switching protocols and trying out new stuff. So I think the answer to that is absolutely, but if you'd like to add anything, please feel free.
Yeah, no, thank you, Megan. The only thing I would say is that, again, it's this fine line between being overprotective, over stringent, which becomes, as I said, when you're putting 130 students on modified quarantine, that's extremely disruptive. I mean, let's say your kid plays in a club team, and they live for their club sport. Well, they don't get to play that club sport for 10 days. That's really hard. Or if your child is in a after school math program and they go to an after school program, they're not supposed to do that for 10 days. And so we realize not forget the testing part, right? The testing part alone is disruptive, but it's also just the after school sports. That being said, yeah, if going to 10 feet or, and obviously we would have to have some conversations with our district people about that. But if extending that net back out to make it a little bit wider, that's very, very possible. Very possible. But great question.
Thanks. Okay, next one. I did get one earlier about vaccination status and how exactly do we know about vaccination status? And the response to that, in case anyone didn't see that, was there's a system, I'm not sure if it's a county or state, it's called CARE. It's where we get all of our vaccination information, not just COVID, but any kind of vaccination information. So that's uploaded, and our nurses work tirelessly at the district to daily, there's new and new vaccinations coming into our system. So this next question is sort of related. For 7th and 8th graders, where pool testing is going to come into play a little bit later, a student who is not COVID vaccinated has to follow a certain quarantine and testing protocol, which is different than a student who is fully vaccinated, which is, yes, true. So how is the school making sure that the student is following the correct quarantine and testing protocol, and are parents asked to send their students' COVID vaccine card? So I would just say to start, and then I'll pass it over to Cosmos here. Certainly when the student is at school, we can monitor it, right? So we can make sure if they are not supposed to be there, we will send them home. We have a process in place right now where every morning we're giving rosters to our middle school first period teachers and saying, send these highlighted kids if they show up today, and we can manage it that way. But once they're outside of school, we are just assuming that parents are doing the right thing and they're following the protocols. We can't be everywhere. So we're really hoping that we're partnering in this with our families and with our communities, and that they're doing the right thing. And as far as sending the actual vaccine card, we cannot ask for that. We can't see that. So we go by what's reported to the system and what's reported to us from families. So I don't know if, John, if you want to answer anything. About that.
I think you covered it, Megan. It's, I thought there was a portal that once students are vaccinated, the thing I'm not clear on, is it the families that enter that information, or does it come from?
No, it's not. That's another question that popped in. My understanding is it's nothing parents do, nothing families do. It's like when you go to the doctor and you've gotten your certain vaccinations, it's in a system that schools use as reporting. So there's not like a form you fill out when you get COVID vaccinated that, you're allowing your child's information to be out there. That's my understanding. I again, I'm in education, not in the medical field, so I'm not entirely sure, but that's what I heard from our nurses.
Yeah. And thank you. And we can just say definitively, it's not Ali Rodriguez on her computer, getting a phone call from a parent and then adding it in the system. That's not how it works.
All right. We've got some thank yous out there. So we just want to echo that back to thank all of you. We know that this hasn't been easy, and as crazy as it's been for us, we know that some of you have been getting those unfortunate close contact calls over and over by just the luck of the draw or the unluckiness, I guess. So we apologize for that. And we just appreciate everybody just being with us and working together, because the only way that this is going to get, solved is if we're all working on it together. So we appreciate that. Right back at everybody.
The other thing I would offer is if this this format of running a meeting, the webinar format, if you would prefer, that you want to have a conversation. I've had some wonderful conversations with parents who actually call with their input about certain things. And in a lot of cases, it informs, when you hear from parents over and over about certain particular things, it informs, the direction you go sometimes and what you're asking for at a district level. And so I do listen to families. Obviously, we, the three of us, Ms. DiMattei, Ms. Skirka, and myself, we don't make all the rules, right? Especially when it comes to COVID. But we definitely can hear the input. We can have those conversations with this district leadership. One of the things that had us really paying attention to the data as far as the classroom spread for middle school was this idea of so many people being put on modified quarantine, so many families affected by this. And we asked, we heard from families and we asked the question, is it necessary? Is the net too wide? And it was from some of those conversations with parents that kind of really led to deeper discussions with our district and kind of switching back. Now, if things blow up and we start seeing significant spread in middle school classrooms, we might have to go back, but we're really trying to use the information we have in front of us to make these decisions. So don't be afraid, send an email. We can talk on the phone. This conversation does not end tonight. Okay. And with that, anything else, Ms. Skirka?
No, I think we're good. I don't know if Ms. DiMattei has anything to add for elementary, but we just appreciate all of you and your patience and support.
I do want to appreciate all our elementary parents. I know that this has been a big change for you guys beginning Tuesday, dropping off the kids at the gate, but we're all hands-on, walking kids to class. So please be assured, we've had a few tears, but the kids are fine and we're getting them to class safely. And thank you for adjusting to this adjustment.
Ms. Skirka, just real quick, there was I'm sorry that I'm showing 6 questions on my screen, Q&A. Did you?
There was a few at the end just thanking everybody. So let me just see if there's anything else that's.
Yeah, so.
There's one about translation and if this is or recorded on YouTube because they were late for a little bit. So I don't know if you want to just repeat.
Well, we are recording this and we'll send it out.
It will come out tomorrow. Yes.
Or,
Spanish.
So we're going to do the Spanish translation and then we'll send that out, right? And as far as this recording, are we thinking, I don't think we determined exactly what we're doing with the recording. Megan, did we say the website?
I think it depends if it can be uploaded on the website or if it has to go in a different format. I'm not entirely sure. So we'll work on that tomorrow and we'll certainly put it in our e-blast, at least telling you where to find it so that everybody will know.
And then
the next question, John, was my daughter's been asymptomatic since she got her first positive test. But after 10 days, she's still going to be positive on the PCR test. So I think you did mention that, but if you want to just say one more time, kind of what to do in that situation.
Yeah. So what I know other families have done is they're getting a note from their doctor saying that, after the 10 days, they need to get, I would say, go to your doctor, get a note that outlines the fact that it will stay in the system for 3 months. And so that your child will be testing positive potentially for up to 3 months. And I've seen doctors' notes and we're using that as evidence that, if there's a positive case. Now, when it comes to the pool testing that we're going to be doing, that is still, we have to figure that out because there's many students across our school district who are going to have it in their system still. And so I don't know the answer to that. I circled that as we're trying to figure out, I need to find out more what our school district plans to do for those students who have already tested positive. So more to come on that.
And then one last one. Sorry if this was already covered, but how do you identify close contacts, as it might not necessarily happen inside of a classroom? So it could be outside, could be a PE or lunch, or just friends gathered together. And I would say for that, we do our best to track those things too. So including lunch, including PE. You can imagine it gets to be sort of a slippery slope if we get a phone call, 3 or 4 days later, and we start saying, well, who did you hang out with on Saturday and Sunday? And were you at this party? And it just is gonna expand kind of our workload, to be honest, and trying to figure out exactly who was where. So we do the best we can within the school setting. But we're hopeful that families will communicate with other families too, if they need to let people know about friends that came over, or whatever was involved outside of school too. So I don't know if you want to add anything there.
No, I think that's covered, and we do work very, very closely with our PE department about that. And a lot of the activities they're doing, it's outside, number one, and the students aren't grouping together for extended periods of time. So they're spread out, and they're doing a lot of those kinds of games and things where they're not grouped together close for 15 minutes.
And I think that's kind of been the trickiest part of this, is because we've had 15 cases here at Bayside, we have turned into contact tracers, which is not, exactly what our jobs are. And so we're doing the best that we can, but it's pretty consuming. So just, as much as families can help with communicating on their own about, outside of school stuff, we appreciate that support as well. And then
All right.
That's it.
I think that's it. And thank you, Ms. Gurka. Thank you, Ms. DiMattei. And just wanted to thank everyone again. We know there's a school district board meeting starting in 3 minutes, so we'll end this. But again, reach out if you have further questions, want to talk more, just reach out to us. We are here and we're in this together. So thank you so much, everyone. Be safe and have a good evening.
And before you guys end, I'm just going to capture the questions here too.